My name is Ann O'Shea. I'm a chaplain with Crossroads Hospice. Well, a chaplain is someone who comes in the name of the organization, in the name of hospice. By its title, a chaplain identifies someone as what we would call a God person. So basically, your right into the room is your title, and your title is chaplain. And so you have to know what that means in order for you to be able to explain it to other people. So a chaplain is someone who has to be authentic, empathetic, and truly committed to being on a journey with another person. A chaplain can't really have its own agenda. Yes, we might pray, and yes, we may have some knowledge that we want to share with people, and we might even have some teachings that we might want to share with people, but we got to keep that very close to our heart. It is not something we put out there easily. It is something that is invited from another person. If we're able to pray with someone, that's wonderful. That's because they want that, not because I want to do it for them. Many times I ask them, is it all right if I say a prayer with you? Some people will say I can pray with them. Some people will say, no, you do the prayer on your own. I don't like people to pray out loud. So again, it's always being on a journey with someone and knowing your purpose in that journey is to be a God representative, a person who listens with compassion and empathy and who authentically believes that her God or his God is a God of loving care for others. I think it's important for a chaplain to be on a hospice team, especially because in the medical model, we always have curing versus healing. But in the hospice team, we're kind of like merged into healing. We don't need to be about curing people. We are there, our whole team is there to provide comfort and ease the pain and to provide care and compassion while they're doing what it is that they can do best for others. So one of the reasons I love chaplaincy and hospice is because we're all a team member on the healing team. We don't have to worry about curing anymore. And I also think it's an important part of our journey. When someone is now able to say that they're on hospice, maybe the family can say it and the patient is not conscious of it. Maybe the patient can say it and he or she is conscious of it. But it's the journey that focuses in on dying. And that is the uniting force, whether people talk about it or not. And a chaplain, just by his or her presence and title, invites people to talk about their wounds, their fears, their uncertainties, because this is the time when the now of life is becoming very, very temporary. And because of that, I think you need to have people around you with whom you can share as well as get care from. And I think a chaplain can invite that conversation with another about their journey, but always allowing the person to be in charge of the journey. I think sometimes the effect of a chaplaincy or the effect of spiritual care on a death situation is really powerful. You know, people die and you're expecting it, but you're not expecting it. You want it, but you don't want it. You have that sense of comfort, relief, and loss. And then you have all of this trauma around who can do what to do next. You know, someone's worried about the uncle that, no, he hasn't talked to his brother in years. He's going to go to hell because he didn't talk to his brother. You have a lot of dynamics in which you need to address by listening and saying, why do you think that? Why do you think that God would punish this person because he didn't talk to his brother? Do we know what's in somebody's heart? Maybe on the outside he never talked to them, but maybe on the inside he had conversations with them all the time. We don't know that. And that's why I think you need to allow your sense of mystery and wonder to broaden the now of the trauma. Because if the trauma is all rooted in what people know, and people don't know mystery, they have to live it. I think chaplaincy is a real honor to be a part of it, to be called to it, and also to recognize how all our partners are part of our ministry. We're not just the spiritual care people. All of our team is about that care.